Doctors may not prescribe herbal supplements like we write for lisinopril or amlodipine, but we're still responsible for understanding their effects on the human body and interactions with other medications. So let's dive into it. First and foremost, we are doctors. We cannot police what goes on inside your body, and we certainly do not report to the authorities when someone does test positive for something, like drugs. That's not our job, and is actually protected by doctor-patient confidentiality laws. Information like that only matters to us when it impacts our work and the medications that we may prescribe. If you come into the hospital with acute onset chest pain, I'm not calling your job and telling your boss that your urine sample came back positive for cocaine metabolites. What's important to me is that I avoid giving you beta blockers for the chest pain because that'll lead to unopposed alpha agonist activity from the cocaine, putting you in danger of further coronary vasospasm. That's my priority in the moment. I can counsel you on avoiding cocaine use in the future, but it's not my job to go break into your house and confiscate your fun powder.
I'm sure it looked easier on YouTube.
In a less illicit case, let's go over these herbal supplements and why your doctor's office will ask you if you're taking any on your visit paperwork. Some of these substances on the list are things that are quite commonly sold at your local convenience store. Things like ginkgo, ginseng, saw palmetto, and St. John's wort capsules are packaged and marketed right alongside your generic multivitamins, CoQ, and fiber supplements. Again, it's not my business what you decide to take and why, but it does alert me to things that I need to watch out for before I start prescribing my medications. Here's another one. Did you know that grapefruit juice is a potent CYP3A4 enzyme inhibitor and will decrease the metabolic processing of medications that pass through the same enzyme? This means that if I was prescribing you atorvastatin or simvastatin for high cholesterol, your actual dose might actually be double or triple than what I intended because your body is going through the meds at a slower rate. On the other hand, St. John's wort is a potent inducer of the same enzyme, meaning that it increases the activity of the metabolizer instead. So if you were taking a medication like warfarin for atrial fibrillation or an immunosuppressant like tacrolimus following a kidney transplant, then you would actually be experiencing a lower dose than prescribed, since your body is chewing through the available medication twice as fast. So, being honest with each other and just laying out all the cards only helps us take care of you better.